Okay, in our last video, we discussed about PeutzJeghers syndrome. Now we're going to talk about the clinical criteria that is used to diagnose the PeutzJeghers syndrome. Now, this involves the presence of any of the following four. The first one is the presence of two or more PeutzJeghers type hematomatous polyps in GIT. And the second one is the presence of mucocutaneous hyperpigmentation in a person which have a family history of PeutzJeghers syndrome. And similarly, if the patient have a family history of PeutzJeghers syndrome in first degree relative, the presence of any number of PeutzJeghers polyp is sufficient to diagnose the person as PeutzJeghers syndrome. And the last one is any number of PeutzJeghers polyp in a person which have mucocutaneous pigmentation, which means that if the patient have polyp plus mucocutaneous pigmentation, then it's most likely to have PeutzJeghers syndrome. Okay, so if the criteria for PeutzJeghers syndrome is met, then the patient is sent for SKT11 gene testing. And if this mutation is found, then the diagnosis of PeutzJeghers syndrome is confirmed. But if the gene testing comes out negative, then we will not rule out the PeutzJeghers syndrome, but we will keep him under surveillance by either colonoscopy, video capsule, and endogastroduodenoscopy.